What would you do if a heart attack struck and no one was around to help? Could a few simple actions really make the difference between life and death? And what if you learned that your body quietly warns you days before it happens? Would you know how to listen? These are not questions pulled from a dramatic movie script. They reflect the real, urgent reality faced by millions of older adults living alone, particularly across Latin America. Imagine it, waking up one morning, sipping your coffee, and carrying a silent fear in your chest. What if today's the day? The fear of a heart attack happening while you're completely alone. No one to call out to, no one to help, just you, and the seconds ticking by. In this video, we're guided by someone who's been at the heart of it all. Dr. Esteban Ramirez, now 83 years old, is a cardiologist with more than 4 decades of experience. Over the years, he's treated more than 60,000 heart patients, and what he shares here could very well save your life, or the life of someone you love deeply. You'll want to stay with us until the end, because Dr. Ramirez is revealing 8 critical steps that anyone can take to survive a heart attack when they're alone. He'll also walk you through the 5 early warning signs your body may be giving you, signals most people tragically ignore. And if that weren't enough, he offers 3 golden habits to help prevent a heart attack before it ever begins. What makes this video different is not just the experience behind it. It's the practical, proven advice that can be applied immediately. Whether you're living alone or care for someone who is, this information is empowering and essential. Before we begin, I'd be grateful if you liked this video. It helps us reach more people and continue sharing important lessons from a lifetime of medical experience. And if you haven't already, subscribe and turn on the notification bell so you don't miss any future health insights. If you find value in what you're hearing today, let us know. Comment the number 1 if you liked it, or 0 if you think we can do better. Your feedback truly helps. Now, let's begin. Each morning, across Latin America, millions of elderly individuals face a quiet but deeply unsettling fear. The fear of suffering a heart attack alone. No warning sirens, no neighbor rushing in, just isolation and the ticking of time. And sadly, that fear is not unfounded. In the absence of immediate assistance, the odds of survival drop dramatically. But that's exactly why this message matters. I'm Dr. Esteban Ramirez, and for more than 40 years, cardiology has been my life's calling. I've walked alongside tens of thousands of patients, many of them elderly and living alone. I've seen what works and what doesn't when seconds count. From minor irregularities to sudden life-threatening emergencies, my decades of experience have shown me just how devastating heart attacks can be. But just as importantly, I've witnessed the incredible power that knowledge and preparation can have in saving lives, sometimes in the most unexpected moments. That's why today, I want to speak to you with the same honesty and care I offer to every patient who sits across from me in my clinic. This conversation isn't theoretical. What I'm about to share could very well determine whether you survive a heart attack or not. That may sound dramatic, but when you understand the statistics and what you can do to improve them, you'll see exactly why this message is so urgent. The reality is harsh. If you suffer a heart attack when no one is nearby to help, your chances of dying can be as high as 89%. That's nearly 9 out of 10. For many seniors living alone, that's a terrifying number, and an all-too possible scenario. But here's the good news. That number doesn't have to define your future. Research and real-world results show that when you understand the early signs of a heart attack and act quickly, within the first 10 seconds, you can dramatically improve your odds. In fact, your survival rate can increase to as high as 92%. Think about that for a moment. The difference between those 2 outcomes isn't luck. It's not based on age or fitness. It's simply knowledge versus unawareness. In those critical first moments, when every second feels like a countdown, A lack of information can be just as dangerous as the heart attack itself. That's why I'm here. Drawing on over 40 years of medical practice, I'm committed to sharing life-saving insights. Insights that can empower you or someone you love to take the right steps when it matters most. And to help you understand just how real this is, let me tell you a story. One that still brings emotion to my heart. A few weeks ago, my phone rang at 3 o'clock in the morning. The voice on the other end was trembling, filled with emotion. "Doctor," she said, her words broken by tears. "It's a miracle. My father survived. Thank you for teaching him what to do." She was talking about Mr. Jose Mendoza, a 78-year-old patient of mine who lives alone. He had just suffered a heart attack in the quiet of his own home. No one around, no time to call for help. But he remembered what I taught him, and that made all the difference. With no one around to help, Mr. Jose had only one thing to rely on: the steps I had taught him during a consultation months earlier. He remembered them clearly, and in those critical moments, those very steps kept him alert, helped him take control, and ultimately guided him to reach the hospital in time for life-saving medical treatment. His presence of mind, built on preparation, made all the difference. When I visited Jose in the hospital, I expected gratitude, but what he said left a lasting impression on me. He looked at me with steady eyes and said, "If I hadn't remembered what you explained to me, doctor, I would be dead today." That sentence echoes in my mind to this day, not because of drama, but because of the truth in it. His survival wasn't random. It wasn't luck. It was readiness. He had listened closely during our appointment. He had taken the time to understand and even rehearse the steps I had given him. So when the moment arrived, quiet, unannounced, but deadly, he wasn't caught off guard. He didn't panic. He responded. And that's exactly why I'm sharing this message with you now. Because heart attacks often don't look or feel the way you expect. They aren't always explosive scenes like we see on television, with someone gasping, grabbing their chest, and falling to the floor in dramatic fashion. In reality, they are often much quieter, more deceptive, and far more dangerous because of that silence. Let me walk you through exactly what Mr. Jose experienced, because it could just as easily happen to you or someone you love. That morning, it was business as usual. He rose at 5 o'clock a.m., just like he did every day. He made his morning coffee, settled into his chair, and opened the newspaper. A calm, uneventful start to the day. But then, something felt strange. He noticed a sensation in his chest. It wasn't a stabbing pain. It wasn't sharp or sudden. Instead, it was a dull, deep heaviness, as though an invisible hand were pressing firmly on his heart. It was subtle enough to be confusing. His first thought? Maybe it was indigestion from the meal he had eaten the night before. He tried to ignore it. He sipped more coffee. He shifted in his seat. He waited. But instead of passing, the sensation grew stronger. As 10, then 20 minutes ticked by, the pressure in his chest didn't ease. It deepened. What began as a curiosity was slowly becoming something far more serious. By the time 30 minutes had passed, Jose felt a creeping numbness radiate down his left arm. It wasn't sudden, but it was steady. Then came a dull, aching pain in his jaw, one that didn't make sense but refused to go away. That's when the realization struck him, clear and sharp. This is a heart attack. That moment of clarity didn't come from panic. It came from preparation, the kind we had talked about months before. That recognition, born from the knowledge he had absorbed, is what set him apart from so many others. Had he brushed it off, telling himself, "It's probably just my age," or "Maybe it's stress," or "Let me wait a bit and see if it passes," we likely wouldn't be having this conversation today. He wouldn't be alive to tell his story. Sadly, his story is the exception, not the rule. Medical studies show that 87% of people having a heart attack misinterpret their symptoms. They assume it's something else: indigestion, a cold, a pulled muscle. They delay action, waiting for things to get better. But during that wait, minute after minute passes. And with each passing minute, the heart muscle suffers irreversible damage. And if you live alone, as many seniors do, the risks rise even higher. For those over 65 who live by themselves, the data is clear. They are 4 times more likely to die from a heart attack compared to people who have someone nearby. Not because their hearts are weaker, not because they are less deserving of help, but because they don't get help in time. When you're alone and something feels wrong, it's easy to doubt yourself. Maybe you don't want to make a fuss. Maybe you think calling for help would be overreacting. Or maybe you're just frozen in uncertainty. But here's the truth. Those moments of hesitation can be deadly. That's why I'm here. And why stories like Jose's matter. Even if you live alone, you don't have to be helpless. You can take action. You can be ready. You can learn to recognize what's happening and respond before it's too late. Jose's survival is living proof. Several months before his heart attack, he had attended one of my local health talks, a small gathering at a community center. I had walked the audience step by step through exactly what to do in case of a heart attack, especially when alone. He listened. He asked questions. He went home and remembered what he learned. So when the moment came, he didn't panic. He didn't waste time hoping it would pass. He looked at the clock. He took a steady breath, and he thought to himself, "All right, it's time to follow the steps." That calm, measured decision, made in the most frightening of circumstances, saved his life. The truth is, the line between those who survive a heart attack and those who don't often comes down to one thing: preparation. Those who are prepared don't freeze. They don't waste precious time second-guessing or panicking. They stay focused, even in a life-threatening situation, because they already know what to do, when to do it, and in what order. That clarity saves lives. On the other hand, those who are unprepared often find themselves gripped by fear. They hesitate, make rushed or harmful decisions, or simply wait too long, hoping the discomfort will pass. Unfortunately, that window of hesitation is when permanent damage, or even death, can occur. And the stakes are even higher for those who carry predisposing health conditions like high blood pressure, diabetes, elevated cholesterol, or a history of smoking. These risk factors don't just increase the likelihood of having a heart attack, they also accelerate the damage once one begins. For these individuals, the need for fast, informed action becomes even more urgent. But here's the most empowering truth I can offer you today. Even if you have these risk factors, you are not powerless. You can take back control. Preparation can shift the odds dramatically in your favor, and Mr. Jose is proof of that. Today, he's living a full and active life. He takes daily walks through his neighborhood, enjoys quiet mornings reading his favorite books, and most importantly, cherishes time with his grandchildren. All because he was ready when it mattered most. He didn't let fear or doubt stop him. He remembered the steps and followed them. If you're still with me and finding these lessons helpful, I'd love to know. Please comment the number 1 below so I know you're still watching and learning with me. Thank you for giving me your time and attention. It means a great deal. Now, let's talk about something even more essential: recognizing the warning signs. Before we move into the specific steps you can take during a heart attack, you need to understand what your body may be trying to tell you before the crisis even begins. Heart attacks rarely come without warning. Your body almost always sends messages, subtle but powerful, if you know how to listen. And so, I want to ask you this. Would you be able to recognize those signs if they happened to you today? Because catching them early could be the difference between surviving and not. I urge you to memorize these 5 critical warning signals. Write them down. Share them with your loved ones. Make them part of your daily awareness. These signals could very well save your life, or someone else's. Let's begin with the most common and easily overlooked: a sensation of pressure, tightness, or heaviness in the center of the chest. It might not be sharp pain, it may not even be intensely painful, but many survivors describe it as feeling like a weight is pressing down, almost as if someone were sitting on their chest. This sensation is not usually the sharp, stabbing pain people often imagine, nor is it a burning feeling like acid reflux. Instead, it feels as though something heavy is sitting squarely on your chest, as if a boulder were pressing down, restricting your ability to breathe freely. Some of my patients have described it as a deep, internal squeezing, almost as if someone had their hand wrapped around their heart and was slowly tightening their grip. This type of discomfort doesn't fade quickly. It typically lasts for more than 15 minutes and doesn't respond to over-the-counter medications like antacids or mild pain relievers. That's one of the most telling signs. It lingers, resists common solutions, and signals that something far more serious may be happening. If you ever feel this, don't brush it off. Next is radiating pain. While the discomfort often begins in the chest, it can quickly spread to other areas of the body, especially the left arm. But it doesn't stop there. In some cases, the pain may extend to both arms, the neck, the jaw, or even the upper back. And for women, one of the most frequently overlooked symptoms is jaw pain. In fact, I've had female patients who, feeling that discomfort, assumed they were dealing with a dental issue. Instead of going to the ER, they booked dentist appointments, only to learn later that what they were experiencing was the early stage of a heart attack. That delay could have cost them their lives. So I urge you, any pain that radiates from the chest outward should be taken seriously, especially if it's unusual or persistent. Another subtle but significant symptom is unexplained, extreme fatigue. I'm not talking about the kind of tiredness you feel after a long day or poor sleep. This is a deep, sudden exhaustion that seems to come out of nowhere. One moment, you may feel fine. The next, you're completely drained, as if your energy has been sucked out, even though you haven't done anything strenuous. This kind of fatigue is especially common in women and is often overlooked because it's so easy to blame it on stress, lack of sleep, or simply the aging process. But if that fatigue shows up alongside other symptoms, like chest discomfort, jaw pain, or shortness of breath, it's not something to ignore. It may be your heart's way of signaling that it's not receiving enough oxygen. Now, let's talk about two more red flags that often occur together: shortness of breath and a sudden cold sweat. Imagine you're sitting quietly, perhaps reading or watching television, and all of a sudden, you feel winded, like you've just climbed a flight of stairs or jogged across the street. You haven't moved, but your chest tightens and you begin to struggle to catch your breath. At the same time, you break into a cold, clammy sweat. Not because of heat or exertion or fever, but a sweat that feels wrong, out of place. These two symptoms, when they appear together, are major warning signs of a heart attack in progress. This kind of shortness of breath, especially when accompanied by a cold, clammy sweat, is a warning sign you cannot afford to ignore. And it's particularly alarming when it occurs in a cool or relaxed environment. Not while exercising or in heat, but while you're resting. Many people mistake this for anxiety or panic. But when it happens alongside chest pressure, radiating pain, or sudden fatigue, it often means your heart is in serious distress. Next, we must talk about symptoms that are even more commonly overlooked: dizziness, nausea, or vomiting. If you suddenly feel lightheaded, as if the room is spinning, or as if you're about to faint, it could be much more than a moment of low blood sugar. Similarly, if you experience unexplained nausea or begin vomiting without warning, don't immediately assume it's indigestion or food poisoning. So many patients reach for an antacid, thinking it's just something they ate. But what if that nausea is actually your heart's cry for help? These symptoms, especially when paired with others like chest tightness or jaw pain, are urgent signals. Don't wait. Don't guess. Take action. And here's something that many people don't realize. You don't need to have all 5 of these warning signs to suspect a heart attack. Experiencing just 2 or 3 should be enough to raise a red flag. Don't wait for every box to be checked before you take it seriously. In fact, if you have existing risk factors, such as high blood pressure, diabetes, high cholesterol, or a history of smoking, even a single warning sign is enough to warrant immediate response. Time is your greatest ally, or your greatest threat. Take Mr. Jose, for example. He experienced 3 of these 5 symptoms: chest pressure, pain radiating down his arm, and a wave of sudden, unexplained fatigue. That combination told him everything he needed to know. He didn't second guess. He didn't wait for more proof. He acted. And that decision saved his life. His quick thinking helped minimize heart damage, making a full recovery possible and allowing him to return to his regular routine and enjoy life with his family. Now, we arrive at the most important part of this message. These are the 8 life-saving steps that you must follow if you're alone and believe you're having a heart attack. These are not complicated procedures. They don't require medical equipment or training. What they require is clarity, presence of mind, and immediate action. Even if you live far from the nearest hospital, even if there's no one around to help, these steps can boost your chances of survival to as high as 90%. That's why it's so important to learn them and commit them to memory. I urge you to listen carefully, take notes if you can, and even practice these steps regularly, just like you would rehearse a fire escape plan. In a moment of crisis, preparation becomes your greatest ally. It's not about having special equipment or medical expertise. It's about knowing what to do, staying calm, and following through with purpose. Step 1. Stop and sit in a safe place. The very moment you notice chest pressure, unusual pain, or other warning symptoms, stop whatever you're doing immediately. Don't push through it. Don't assume it will pass. Find a secure and stable place to sit down. That's exactly what Mr. Jose did. He made his way to a bench near his front door, where his back was supported by the wall. This seemingly small decision made a big difference. It kept him from collapsing or blacking out, and more importantly, it allowed him to stay conscious and aware, ready to take the next step. So, what should you do? Choose a chair, a sofa, or a sturdy bench, somewhere that gives your back support and keeps you upright without strain. Avoid walking around or standing for too long. Sitting down reduces the stress on your heart and helps maintain blood pressure stability, increasing your odds of staying awake and coherent while help is on the way. Step 2. Chew an aspirin, if available and safe. If you have aspirin nearby, and you know you're not allergic or on a medication that conflicts with it, this could be a life-saving move. Take a 100 mg tablet and chew it thoroughly. Don't swallow it whole. Why? Because when you chew the aspirin, it begins dissolving in your mouth, allowing it to enter your bloodstream much faster than if you swallowed it intact. This rapid absorption is essential during a heart attack. Aspirin works by thinning your blood, helping to break apart or slow down blood clots that may be blocking the arteries to your heart. The difference in timing could be the difference between minor damage and a fatal outcome. In fact, studies have shown that chewing aspirin during the early stages of a heart attack can reduce cardiac damage by up to 40%. That's not just a statistic, that's a second chance at life. Let me share a real story with you. Mrs. Teresa Gutierrez, a 76-year-old widow living alone in a modest apartment, woke one morning with a heavy tightness in her chest and a wave of weakness unlike anything she'd felt before. Her first instinct was to dismiss it, but then she remembered something she'd heard during one of my community health talks. Though trembling with fear, she reached into her medicine drawer, chewed a 100 mg aspirin tablet, and called emergency services. That one action, prompted by preparation, likely saved her heart from irreversible damage. When she finally arrived at the hospital, the attending cardiologists confirmed something remarkable. Her quick, decisive action had significantly limited the damage to her heart muscle. As a result, she was able to make a strong recovery with few complications. Her story is living proof of the power of a single step, taken at the right time. So, if aspirin is within reach and it's safe for you to take, it can be a game changer. However, I must emphasize, if you're allergic to aspirin or if you suffer from gastric ulcers or other conditions that make its use dangerous, do not take it. Instead, move forward to the next crucial step without hesitation. Now, if you have a personal or family history of heart problems, it's wise to stay prepared. I often advise my patients to keep a small supply of 100 milligrams aspirin tablets in a place that's easy to access during an emergency. It could be on your refrigerator, inside your medicine cabinet, or even stored in a clearly labeled container in your purse or wallet. Wherever you keep it, make sure it's stored in a cool, dry spot to preserve its effectiveness over time. Step 3. Call emergency services and state your location clearly. When it comes to heart attacks, every second counts. One of the greatest dangers is losing consciousness before help arrives. That's why your next step, after sitting down and chewing aspirin, if appropriate, is to immediately call emergency services. In Spanish-speaking countries, the emergency number varies: 911 in some areas, 131 or 107 in others. Whatever the number is in your region, know it by heart and save it on your phone's speed dial or favorites list. When the operator answers, don't delay. Clearly and calmly provide your full name, address, and symptoms. For instance, you might say, "My name is Luis Gves. I'm at 25th Street, number 132, apartment 3B, Elro Building, in City. I'm experiencing chest pain and shortness of breath. I believe I'm having a heart attack." Deliver this message with clarity and focus, because even if you lose consciousness during the call, that information ensures help will still reach you. Stay on the line and continue to answer the dispatcher's questions honestly and calmly. Avoid brushing off your symptoms by saying things like, "It's probably nothing," and also steer clear of exaggerating. Both can delay or misguide the emergency response. If you're able, try to note the exact time your symptoms began, as this will help the medical team evaluate the severity and plan the best course of treatment. Step 4. Unlock your door and make access easy. Once the call is made, don't forget to prepare your home for the arrival of paramedics. This step is often overlooked, but is absolutely critical. Unlock your front door to save precious moments when responders arrive. If possible, leave the door slightly ajar to avoid any fumbling with locks or keys. In homes with keypad entry systems, write the access code on a large visible sheet of paper and tape it directly on the door, or leave it in a spot that responders can't miss, like the doorstep. Every second you save could be the difference between survival and tragedy. If you have a traditional lock on your door, place a spare key in an easy-to-find spot. It might seem small, but this action can make a huge difference. Consider slipping the key under a doormat, inside a flower pot, or on a nearby entryway table. This simple step could be the bridge between life and loss. In emergency situations, every second matters. I recall a recent case in Buenos Aires where paramedics were delayed by 10 crucial minutes because they had to force their way through a locked door. That delay nearly cost the patient his life. Now is not the time to worry about security risks or the possibility of theft. Your life is far more important than your belongings. If you're still here watching and these insights are helpful to you, please type the number 2 in the comments below. That way, I'll know you're with me, continuing this life-saving journey together. I deeply appreciate your time and your commitment to your health. Step 5. Position your body at a 45-degree angle and elevate your legs slightly. When you're experiencing a heart attack, how you position your body can make a significant difference. The goal is to maximize oxygen flow while minimizing the workload on your heart. The best position is a semi-reclining one, around a 45-degree angle. You can achieve this by leaning back on a firm chair, a sofa, or even a stack of pillows that support your upper back. Next, gently raise your legs by resting them on a cushion, a footstool, or a low coffee table. This slight elevation helps promote better blood flow back to the heart and brain, which is essential during a cardiac event. Avoid lying flat on your back, as this can lead to fluid accumulating in your lungs, making breathing more difficult. On the other hand, sitting completely upright may place unnecessary strain on your cardiovascular system. Think of the position you'd assume in a reclining chair, comfortably supported but still alert. It's the sweet spot where your body can function most efficiently under stress. Step 6. Send a brief and clear text message to family or trusted contacts. During a heart attack, it's critical to conserve energy. Talking on the phone, especially in a state of panic or distress, can increase your heart rate and strain your body further. That's why a better alternative is to send a concise, informative text. Keep it short and direct. For instance, "I'm having heart attack symptoms. I've already called emergency services. They're taking me to hospital name. Please meet me there." Send this message to at least 2 or 3 close family members or friends. This ensures that even if one person doesn't check their phone right away, someone else will. By sending it to multiple people, you increase your chances of having support waiting for you when you arrive at the hospital. Even when you're alone, this simple action creates a line of connection, so you're not entirely by yourself. In times of crisis, knowing that help is on the way can be just as powerful as the help itself. This step allows you to notify your loved ones without putting unnecessary strain on your already taxed system. Keep the message short, focused, and free of emotional detail. This isn't the time for long explanations, just the essentials. If, however, you feel too weak or disoriented to send a message, don't worry. Prioritize staying calm and conserving your energy until help arrives. Step 7. Practice slow, controlled breathing. This may seem simple, but it's one of the most powerful tools at your disposal during a heart attack. Controlled breathing helps reduce your heart's workload, stabilizes your pulse, and keeps oxygen flowing steadily through your body. It also calms your nervous system, which is essential when fear and pain can easily take over. Here's what to do. Inhale slowly through your nose, counting to 4. Feel the air filling your lungs and expanding your abdomen, not just your chest. Then, exhale gently through your mouth over 6 seconds, making a soft whoosh sound as you release the air. This type of diaphragmatic breathing activates your parasympathetic nervous system, lowering stress hormones and helping your heart function more efficiently. Let me share the story of Maria Lopez, a 62-year-old retired teacher who experienced the onset of a heart attack while at home. Remembering this technique from a community health seminar, she closed her eyes and began slow, rhythmic breathing while waiting for the ambulance. Later, she told me it helped her stay mentally focused and physically steady, preventing a full-blown panic response that could have made things worse. The key is practice. Don't wait until an emergency strikes. Try this breathing method daily, so that when the moment comes, your body knows exactly what to do without hesitation. Step 8. Apply pressure to your wrist and cough forcefully. Though not commonly discussed, this lesser-known method can offer temporary stabilization during the early stages of a heart attack. Here's how it works. Use your thumb to press firmly on the inside of your wrist, specifically over your radial artery, where you can feel your pulse. As you apply that pressure, take a deep breath and cough forcefully, 3 times in quick succession. This technique, sometimes referred to as cough CPR, may help maintain circulation by creating rhythmic chest pressure. While it's not a substitute for medical intervention, in certain scenarios, it could keep you conscious just long enough for help to arrive. It's important to understand that this method isn't universally endorsed as a standard medical protocol, but when practiced alongside other steps, like breathing control and calling emergency services, it can offer an additional layer of support. Think of it as a temporary bridge until professionals can take over. Coughing creates a surge of internal pressure within your chest cavity, mimicking the mechanical action of a heartbeat. This spontaneous compression helps stimulate blood flow momentarily, while simultaneously pressing on the radial artery at your wrist may help regulate an erratic heart rhythm. Though not a substitute for immediate medical treatment, this technique, often referred to as cough CPR, can serve as a temporary measure. buying you critical extra moments to stay conscious, especially if you're feeling dizzy, faint, or notice your pulse racing or fluttering unexpectedly. Take a moment now to practice it gently, not to induce strain, but simply to get familiar with the coordination. Deep breath in, firm thumb pressure on your wrist, then cough sharply. It's simple, yet when done correctly in an emergency, it may be just enough to hold off collapse until help arrives. Let me return to Mr. Jose Ramirez. On a peaceful afternoon, when he felt a subtle pressure building in his chest, he didn't panic. He remembered exactly what we discussed during our clinic session. Calmly, he sat down near his front entrance, took a chewable aspirin, called emergency services, provided his precise location, and unlocked the front door. Then he positioned himself at a 45-degree incline, sent quick messages to both his daughter and son, began his slow breathing routine, and applied the cough technique alongside wrist pressure. 14 minutes later, the paramedics arrived to find Mr. Jose still fully conscious, remarkably calm and physically stable, ready to be transported safely for professional intervention. His composure, built on preparation, played a pivotal role in his survival. After successful treatment at the hospital, his heart now functions normally, and he's back to enjoying time with his family and friends. His story has since encouraged countless others in his community to learn and practice these 8 steps, because what saved him could one day save you. Now that you're equipped with this emergency response plan, let's go one step further. Acting during a heart attack is crucial, but preventing one before it ever occurs is even more powerful. The next section of this message will walk you through 3 golden daily habits that, according to long-term studies and clinical data, can reduce your risk of heart attack by over 70%. Just imagine what your life would look like with that kind of protection. These 3 golden habits are not only practical and easy to adopt, but they've also been proven effective for people of all ages. They don't require fancy equipment or expensive supplements, just your commitment and consistency. Golden habit number 1. Walk for 30 minutes every day. It's one of the most powerful and accessible forms of heart protection. You don't have to push yourself to run marathons or invest in a gym membership. The goal isn't speed, it's sustainability. A consistent daily walk, just 30 minutes, is enough to improve circulation, regulate blood pressure, lower cholesterol, and strengthen the heart muscle over time. Take Mr. Ernesto Salazar, an 82-year-old resident of Tuca, Mexico. For over 25 years, he's made it a ritual to walk in his local park every morning at 6 o'clock a.m., rain or shine. When asked why he never misses a day, he simply says, "It's not about how fast I walk. It's that I walk." His latest medical reports reveal a heart so strong, it resembles someone 2 decades younger. That's the impact of consistency. If you're just getting started, begin with 10 minutes a day. Once your body adapts, gradually increase it to 30 minutes. Choose a route that brings you joy. Invite a friend or family member to join you, or listen to your favorite playlist to make the time more enjoyable. Golden habit number 2. Drastically reduce your salt intake. Many people overlook this one, but excess sodium acts like a silent saboteur, elevating your blood pressure, stiffening your arteries, and significantly increasing your risk of heart attacks. The average person consumes much more salt than the 5 grams per day recommended by health authorities. A large portion of it hides in processed foods, canned soups, cold cuts, snack chips, and even seemingly innocent items like bread. To safeguard your heart, it's crucial to minimize these and focus on whole, natural foods like fresh fruits, vegetables, legumes, and whole grains. Mrs. Rosario Mendez, a 79-year-old grandmother, found this change challenging at first. She said her food tasted flat and flavorless without salt. But after just a few weeks of cooking with fresh herbs, spices, and citrus, her taste buds adjusted. Now, she laughs, salty food feels overwhelming. And the results speak for themselves. Her blood pressure stabilized, her energy returned, and she felt noticeably lighter. Begin by checking food labels, staying away from products with high sodium content, and experimenting with flavorful, salt-free seasonings like garlic, rosemary, turmeric, or lemon zest. You might be surprised how delicious food can be without the salt. Golden habit number 3. Quit smoking and reduce alcohol consumption. Both habits silently destroy your cardiovascular system, damaging your blood vessels, elevating blood pressure, and making blood more likely to clot. But here's the good news. No matter how old you are, stopping now can significantly improve your heart health. Take Mr. Carlos Rivera, a 74-year-old retired mechanic who smoked for over 50 years. At age 70, he finally quit. "I thought the damage was already done," he confessed. "But within 6 months, I could breathe easier, sleep more soundly, and even walk upstairs without gasping." His journey is proof that it's never too late to reclaim your health. If you're feeling overwhelmed, remember this: small changes can lead to massive results. These 3 golden habits, though simple, have helped thousands reclaim their lives, strengthen their hearts, and prevent devastating cardiac events. If you currently smoke, take the first step toward quitting by seeking professional support. Counseling, nicotine replacement therapy, or community-based programs can significantly increase your chances of success. You don't have to do it alone. For alcohol, the key is moderation. That means limiting intake to no more than 1 drink per day for women and 2 for men. Or better yet, consider eliminating it entirely if your doctor recommends it. Equally important, if you're taking medications for conditions like high blood pressure, high cholesterol, or diabetes, never stop or adjust them without speaking to your physician. These medications play a crucial role in maintaining heart health and preventing future complications. Discontinuing them on your own could lead to serious setbacks, even if you're feeling fine. Let's also talk about additional preventive measures that are often overlooked. Beyond your daily habits, regular checkups with your doctor are essential for early detection. Aim for a comprehensive heart health screening at least once a year. This should include tests like an electrocardiogram, ECG, detailed blood panels, and if advised by your doctor, a cardiac ultrasound. These diagnostic tools can uncover hidden threats like arterial blockages, elevated cholesterol, or irregular heartbeats before they escalate into emergencies. If you have risk factors such as obesity, diabetes, or a strong family history of heart disease, you may need to schedule screenings more frequently. Don't wait for symptoms to appear. Prevention and early detection are your strongest defense. Now, let's return to a critical topic: recognizing a heart attack. It's not just about what to do after symptoms appear. It's about knowing when they're happening. That awareness can save your life. There are 5 key warning signs that everyone should memorize and be able to recognize without hesitation. The first is chest pressure or pain. This often feels like intense squeezing, weight, or burning right in the center of your chest. It typically lasts more than just a few moments and doesn't go away with rest or medication. Unlike a fleeting ache, this type of discomfort can come on gradually and persist, warning you that something serious is unfolding. The second sign is radiating pain. Discomfort that spreads beyond your chest, to your left arm, neck, jaw, or upper back, is another major red flag. This radiating pain often creeps in gradually, sometimes masked as muscle strain or even dental discomfort, especially among women. Don't dismiss it. Another critical sign is sudden, unexplained fatigue. We're not talking about being tired after a long day. This is the kind of exhaustion that hits you like a wave, deep, heavy, and out of nowhere. It can feel like every ounce of energy has been drained from your body, even if you've done nothing physically strenuous. Pair that with shortness of breath, and the picture becomes even clearer. Imagine sitting in your living room and suddenly struggling to breathe as if you've just sprinted up a flight of stairs. Add a cold, clammy sweat, lightheadedness, or even nausea and vomiting, especially when combined with other symptoms, and it's time to act without hesitation. It's important to remember that heart attack symptoms don't look the same for everyone. Women, in particular, may experience subtler signs such as fatigue, dizziness, or stomach discomfort, rather than the classic chest pain. That's why awareness and education are vital. When in doubt, treat the situation as serious, because your response could save your life or someone else's. Now, as we approach the end of this life-saving journey together, let me ask you something. What's one insight from this video that you'll carry forward? Maybe it's the 5 warning signals that could alert you in time. Perhaps it's the 8 crucial steps to take if you're ever alone during a heart attack. Or maybe it's the 3 golden daily habits that could help prevent one from ever happening. Whatever resonated with you most, take a moment to reflect. Then, I encourage you to share one key takeaway in the comments below. Let us know what you've learned and how you'll apply it in your life. Your insight could be the reason someone else makes a life-changing decision today. If this video brought value to you or opened your eyes to something important, don't keep it to yourself. Please like, share, and most importantly, subscribe to our YouTube channel for more trusted health guidance that could truly save lives. Thank you for staying with me all the way through. Let's keep moving forward, together, toward a stronger heart and a healthier life. Wishing you lasting health, happiness, and peace. And don't forget to subscribe to Healthy Aging Blueprint for more empowering content like this.